Hi John, it's Ceara Treacy here again with the screencast for the submission of CA3. This is part 2. I'm just going to continue on from where I left off, where I was just highlighting interoperability and the advantages of HL7, and I just discussed briefly and concisely in the end of the last screencast about standardized terminology and the advantages of having that and the benefits of it, and how it would be particularly important in our case in relation to immunisation, as it would be vital that the standardization was applied to the language and the words and syntax that were used for immunisations. The advantages of HL7 are that it allows for interoperability between different competing standards, and a key point to mention is that messages are atomic unit of data, meaning that messages are transmitted as one complete element. Partial messages are not sent or received. Again, vital for immunisation, because it would be important that all of the information in relation to the patient was submitted at once, and that not partial immunisations or partial words were sent. It allows the systems to interpret and use data in a more meaningful manner, so it enables communication with others and additionally prevents misunderstandings, which means that it is very clear what the immunisation would be when it was submitted and who it was submitted for, and it is particular to us because of the intricacies and the varied administrative manner of immunisations, from the GP to the nurse practitioner to eventually at second level school at the age of between 11 and 14. The syntactic interoperability guarantees the exchange of structure of the data. It means that the data will be sent completely. However, how it's interpreted is not in the responsibility, on the realm of responsibility of HL7. However, with immunisation, the understanding is clear from all areas what the immunisation is and what it is for. It has a document standard and several informational elements, which is excellent for immunisation, as the information could straightforwardly pass to any hospital clinic or an EGP. Plus, many of the immunisations are completed with several injections and several different types of vaccinations in one administration visit, so that the fact that there are several informational elements is beneficial here. Excuse me. There's a messaging standard. It allows the information to be more readily accessible, and this is great again for immunisations because of the nature of the paperwork of immunisation, and also the geographical nature of healthcare in Ireland, and it's predominantly rural, and the healthcare providers vary greatly in size and facilities. Plus, it would be also beneficial for the governments that they would be able to receive information from all healthcare professionals and clinics and hospitals and district health nurses to provide very good statistics on immunisation in the country. So I'm going to run now the HL7 code, which in our program is number 6, export patient details to HL7. Oh, it just took a minute to compile it. So I got rid of the commented out the other print where we printed in XML style, and we have our encoded message here. This is a message. It is patient details that we're sending, time and date of it. This is administration, discharge or transfer, ATD. This is classed as an AO1, which means that it is administration, the A part of the ATD, AO1. And the patient information is that it is a male and his surname is Healy and his first name is Zach. And so it goes on for the rest of our database and patients in the database. Again, we have our mesh sequence and we have the patient PID. It's Leila McDonald, female. So the last advantage of HL7 is it ensures an application standard through application interoperability, which is an architecture that allows secure access to separate software applications, which ensures privacy and security not only of health records but additionally of sensitive information relating to the patient, which leads us very nicely on to privacy, security and trust. And this is a discussion on privacy related specifically to our system. And it is a system in place for the patient of the data to authorise its use. It would have two authorised users, the GP and the next of kin, and the practice nurse. It is data segmentation in technology, indicating what data they wish to share. Our system could be used to store information on allergies that may be shared subject to approval of the patient and can be discovered in the child during the immunisation period. Security, that is in relation to how secure the information is and how it won't be accessed by anyone who is not allowed to see it, particularly through transport and exchange, that is from, say, one healthcare provider to another, from a hospital to clinic, and from the clinic, say, to the government. Our system will use secure websites with protected logins, and some things public key infrastructure is used for secure emails, secure browsing, secure documents and secure file systems. The public key freely distributed the encryption, and the private key is known only to its owner and the certified authority that is issued it. A message can be encrypted with either private or public key, and when the key is given to the opposite key, and the message can be decrypted. So that's how to pass it. And that is, I have a message I want to send to you, and I send it publicly, but you need my private key to unlock the information or decode it once you get it through your system. And without that, you won't be able to decode it, and therefore it can't be intercepted and read. Trust is a very big part in patient records, and it would be particularly important as this is the beginning of your public health record when your immunisations are started. You have to make sure that the people who are looking for the information in their organisations say who they are, and that a trusted third party confirms the identity. You have to watch for the message digital signature and certified certificate of authority and certificate signs certified using their private key tied to particular applicants. So it's registration authority, certificate authority and certificate authority then has to sign using their private key tied to a particular applicant. And this is an example down here that Ruth read out during the presentation, and then this is just a little diagram between outlining what I've just talked about. So there's this one healthcare practitioner and another care practitioner. They're sending information to XML securely. They have a key that is locked. This is sent along publicly. This clinician can only open this information if they have the private key, and that will be sent by this Dr. Smith. Okay, John, I think I've covered everything. Thank you for your time this semester, and learnt a lot, and hopefully it will be a great benefit now when I go out into the working place, and have a great Christmas. Thank you.